Hey, everybody, welcome to Making the Most of Your SART. My name is Ashley Anstead. I'm the Criminal Justice Coordinator at Oregon Attorney General Sexual Assault Task Force. I've been at the task force for about 2.5 years now. And previous to that, I worked as a confidential advocate for survivors of human trafficking, where I did a lot of collaborative work and worked with sexual assault response teams that were human trafficking specific. And so I learned a lot about collaboration in those experiences. I'm excited to talk to you about SARTs today. So what we're going to talk about today is what is a SART, and then we're going to talk a little bit about what makes a SART successful. I want to address some of the power differential in decision-making things. And then finally, I want to talk about the importance of evaluation and how that is going to impact the success of your SART. So first, what is a SART? The purpose of a SART is to create a multidisciplinary team that is going to provide a common collaborative response to sexual violence in each community. There's been a lot of national recognition that SARTs are a way to respond to sexual violence that is victim-centered and offender-focused. And so what that means is it's just addressing the needs of the sexual assault survivor and then making sure that we're focusing on holding offenders accountable instead of looking at maybe what victims did or did not do. And what we know and understand is that having a collaborative response to sexual violence is much better than having a siloed response. And this is one of the reasons that Oregon has a statute that requires each county to have a SART. So a lot of what folks say is that a SART is here to balance the needs of the survivor and the needs of the criminal justice system. But what I think is more appropriate is the needs of the survivors and making sure that there is accountability for those that cause harm. And that can sometimes be in or out of the criminal justice system, but it's a collaborative process to make sure that there is equitable access to justice for everybody. So I want to talk a little bit about what the statute says. I'm not going to read what's on the screen, but I'll go over about what it talks about. So all it basically says is that the people that need to be represented at the SART, what the requirement of statute is that it's a district attorney, a representative from the prosecution, DA, advocate, or a systems-based advocate. It usually is from the DA's office. It says here a sexual assault forensic examiner, so either a SANE nurse or if some communities don't have SANE nurses, and so in that case, it is going to be a representative from the hospital. And then it says at the discretion of the district attorney, representative, the county sheriff's office, or local law enforcement agency. And there also must be a representative from the community-based nonprofit agency that works with domestic and sexual violence. It says at the end here, there's other folks should be included and can be included at the discretion of the district attorney. The reason that the statute has the district attorney as sort of the overseer or the oversight of this is just to make sure that there is accountability within the statute. What a lot of counties have found is that having a SART coordinator or somebody outside the district attorney's office or the community-based agency that is running the SART, it can be really helpful. It's a lot to ask to add to folks' plate, and where it usually lands in terms of responsibility is on the district assistance victims assistance program or the district attorney's victims assistance program. And so there's a lot of ways that it runs. The statute only defers to the district attorney. However, to make sure that there's some accountability, it is not required that the district attorney be the one that is responsible for being in charge of the SART. And we'll talk a little bit later about power differential and what that looks like. So what are the basic requirements of the SART? The basic requirements that the statute says the SART must do is develop and evaluate sexual assault response in the county. And so what that means is just making sure that there is a coordinated and collaborative response to sexual violence and all the players involved know what their role is. And then they're required to put that in protocol. And so each county is responsible to have a written protocol about the response of sexual violence within their county. And then finally, it says meet quarterly outside of MDT. We understand that in a lot of small communities, the same people that are sitting at MDT are the same people that are going to be sitting at the SART, and that's fine. But the statute requires that they separate it out to make sure that everybody is giving enough time and attention to adult and adolescent sexual violence within the county. And so they wanted to make sure that it was separate. Because there is often, I think, when it's combined, it's easier to focus on child abuse. I think folks are a lot more comfortable working with child abuse. I think it gets a little less difficult and confusing for people involved about responsibility and fault, unfortunately. But that's why they asked that to separate it out. All right, so now I want to talk a little bit about what makes a SART successful. We talked about what it is, like what are the baselines, but it's important that folks sort of go above and beyond those basics to really have successful SARTs. And they take a lot of work and they take a lot of collaboration and they take a lot of compromise, but they are incredibly important to survivors in the community. So what are the things that makes a SART successful? The first is structure and collaboration, and we're going to talk a little more in depth about each one of these, but the first is structure and collaboration. Next is a diverse membership, and then finally a coordinated response in interdisciplinary training. And so what do we mean by structure and collaboration? So first, I want to talk about mission, vision, and values. Mission statements for SARTs really give a purpose statement. And so they are giving folks an idea about why the SART exists. It is telling your community and also creating buy-in about what the purpose is. What are you trying to do with that SART? It exists to create equitable access to justice for survivors of sexual violence, or create safety and community for survivors of sexual violence while holding perpetrators accountable. Whatever it is that the purpose of your SART is, the mission statement is going to define that for folks. And then there's the shared values. I think those are also really important, because what shared values are going to do is they're going to create overlap for folks that may have different values within sexual assault response. When I think of two disciplines like law enforcement and community-based advocacy, law enforcement values may be different than community-based advocacy, right? Like law enforcement may value transparency and investigation, where community-based advocacy may value survivor voice and confidentiality. Now, those are two different values that they're coming to, or two sets of values they're coming to sexual assault response with. However, there are going to be some overlapping values, things like victim safety, things like equitable access to justice, things like community understanding of how sexual assault response happens, right? And so making sure that folks at the table know what those shared values are, it helps create buy-in into the community and make folks feel like they can collaborate. And then finally, a vision statement, which I think is incredibly important, but SARTs don't always have time to do all of these things. And so I would say do the mission and values first. But what a vision statement does is it gives an idea for the future, like where the SART is going, what the community wants to see happen by having this SART in place. So what they hope the outcomes are going to be. All right, now I want to talk a little bit about goals. Goals are the way that you're going to be able to attain the vision that you have for your community. And what I have here is creating SMART goals are the easiest, most effective way to do that. And what it means to create a SMART goal is creating a goal that is specific, measurable, attainable, realistic, and time sensitive. And so instead of having sort of a broad goal of like, I hope that survivors access more resources, although that can be something that you all hope for your community, by setting a specific goal that you are able to measure, that's attainable, realistic, and time sensitive, helps you understand whether or not that goal is even being achieved, right? And so if it is, you want survivors to access more resources in the community, specific, who do you want to access what resources and by when? And so you can measure those things and make sure that it is something that is attainable, right? And so I want 125% more engagement in 6 months might not be attainable, but 25% over 12 months, possibly. Whatever it is for your SART that you all want to see happen, making sure that you have very specific goals is important to know whether or not you're going to be able to evaluate and measure the whether or not those have been attained. So I want to move on to clear roles and decision making. So having a SART that has clear identified roles can be really important to making sure that it's successfully run. And so knowing who is it responsible for creating the agenda, who is going to be taking notes, who is holding data, who is bringing, how do you bring motions, how do you bring up topics, all of those things, having clear roles and responsibilities, and then I would say even writing those into protocol is incredibly important. Knowing who is responsible for what helps everybody at the table know where to go if they want to talk about something, if they want to bring something to the agenda. And it also allows people to, it helps to offset some of the power differential if it is really clear who is responsible for what. We're going to talk a lot more about decision making a little later and how to create equity through it, but is another thing that needs to be developed to have a really successful SART. I've seen lots of SARTs not do these two things, just sort of default that the agenda goes to the DA's office and to specifically the DA's Victims Assistance Program, and then also not having a clear decision-making process in place. And so if there are any changes that they want to make to sexual assault response in the county, what ends up happening is they just sort of present these things to who they believe are the decision makers, which is the DA's office, and they sort of up or down vote it. And that does not bring equitable access to folks in the community to create a collaborated sexual assault response. And so by having clear roles and responsibilities and a decision-making process, it makes sure that everybody's voice at the table is being heard in an equal way. And then finally, developing and reviewing protocol is incredibly important to the structure and collaboration. Having everybody on board and having it sort of written out, having clear MOUs with other agencies to know whose role and responsibility is what, and where everybody's sort of role is in sexual assault response really helps clarify, and it helps to mitigate conflict because folks at the table are clear about what everybody's role is. So the next piece of having a successful SART is having diverse membership. So we talked about the folks that are required at the table, the DA, Victims Assistance Program, systems-based and community-based, a SANE or hospital representative, and law enforcement. That is what is required. And that can be incredibly important. But what happens when you are just having those lenses at the table, you miss a number of vulnerable folks at the community that may be experiencing sexual violence that your SART, your collaborative process, is not reaching. And so it's important to reach out to different people in the community to make sure that you have all the voices and resources at the table. And I think of places like mental health providers. Is there mental health at the table to talk about? Are there folks that represent the homeless community at the table? Are there people that represent addictions, LGBT resources and community? To have those folks at the table is a more collaborative response to sexual violence, and it ensures that you are getting the lens for some vulnerable communities that you may not have just in having the community-based SADV agency there, along with all the systems-based folks. And so the more diverse the membership, the more of your community you can ensure that you are serving. And by thinking about this, it also creates more equity because there are the voices at the table for those that are underrepresented in the community. So coordinated response for sexual assault response teams also is what helps create sort of healthy, robust SARTs. And in that coordinated response, there is a couple of things that I think is important to talk about and maybe for SARTs to practice. The first thing is systems mapping. And so when I talk about systems mapping, I talk about how each agency, um, having each agency map exactly what happens when a survivor enters their system. So, for example, if each agency at the table, law enforcement, DA, say nurse, community based, and systems based advocate, mapped what happened when a survivor came in, the rest of the folks at the table can get an understanding about what that agency does. So again, for example, I'm going to do a community-based advocacy reference because that's what I have the most experience from. So when I would map that, I would talk about where I get my references from. So is the reference coming from law enforcement, from the DA, or from self-referral? And then what is the next step that happens? Then we do an intake. And then from intake, if the survivor chooses this or that, what happens? And so going through each step in the process for what happens when a survivor enters that system really can clarify for everybody at the table what each agency does and how each agency works and where in the process agencies refer to one another. And you can also see if that piece is missing, right? Like if there is a place in the process that systems-based advocacy could refer to community-based advocacy. When is that happening? And if it's not happening, where could it happen, right? And so you can find places for collaboration, and it really gives folks in the room an understanding of what each agency does. That brings me next to interdisciplinary training. I think that this could and should start with the systems map and continue where you keep different, when you keep different disciplines trained on what protocol is in your agency. And so if there is a change in protocol at the community-based agency, let's say at one time they were allowed to transport survivors in their car, but there has been a protocol change at the agency and they are no longer allowed to transport survivors in the car. Interdisciplinary training can be a place where they can train about what that protocol difference is. And then there is an opportunity to brainstorm solutions about how to fill that gap, right? And so interdisciplinary training just keeps each agency understanding what others are doing and how they can help collaborate and fill gaps. And then finally, another way to ensure there's coordinated response is systems mapping, or I'm sorry, response mapping. And this is different than systems mapping. Response mapping is mapping the overall response in the county. A creative way that we have found to do this is take maybe a survivor composite, so a made up scenario, and then take that person all the way through the system. And so if that person reports to the hospital, what happens next? And then what agency do they get reported to? And then how does that work? And so making sure that there are no gaps in the system. This is when you're going to identify things like, well, how is a survivor getting home from the hospital? Do we have somebody that can transport? Is there money for Uber, Lyft, rideshare? Is there possibilities to sort of break down some of the barriers that people have to accessing systems, accessing justice, and accessing resources? All right, now I want to talk about power differential and decision making. I think this is really important to talk about in SARTs. I think folks know it exists, but it's not often named out loud. And I would say less often we talk about ways to mitigate the power differential. So we know there's an inherent power differential in SARTs. I think sometimes, like I said, it can be difficult to name, but when we think about who has the power in the room, right? And I don't just mean that like who has the most voice, but who has the ability to make change? Who has the most influence in the life and world of the survivor or the person that has caused harm, right? And I think that there are power differentials in criminal justice inherently in the DA system. Law enforcement is very hierarchical. I have a really hard time saying that word, but you know what I mean. There's a hierarchy in law enforcement they're expected to follow. And so there are some of those inherent power differentials that exist. And then when there are different value systems that are in place, if there are a number of folks in the room that share one value system and less folks in the room that have a different value system when it comes to working with survivors, it can create that power differential. So I think it's important to name it. I think again there is a lot of ways to mitigate some of that. I think one of the good ways to help do that is in the structure and in the role creation, having a shared collaborative leadership structure. And so it is not just falling to the DA and specifically the DAVP to create the agenda. Instead, the community-based program and the DA's agency work together to create the agenda, or law enforcement and a sane nurse chair the meeting together, right? Whatever the power sharing is, but to make sure that the different systems in the room are coming together to collaborate and to share power within the room, that it is not just one agency or discipline that is taking over. So decision making is another way to help sort of offset that power differential. So I want to talk about a couple of different decision making structures, and then I want to go into consensus decision making a little bit more, because what I have found in my experience, consensus decision making seems to be the one that brings the most equity to the room. So the first form of decision making is formal authority, and this is where somebody is in charge of making decisions. It is similar to what I talked about earlier when in the SART, where the DA's office is the one that is making most of the decisions. And so what happens is if there is a proposed change in the way things are done or how sexual assault response is handled in the community, there's basically a presentation that needs to be made and submitted, and then there's sort of an up or a down, because there is no formal decision-making process. And it wasn't decided that there's going to be a formal authority, but that's sometimes just what happens when there is not a structure that's in place because of the inherent power differential and the way things fall. Now, the next decision-making process is majority rules. And I think that this is a structure that a lot of SARTs use, and I think that it's really successful for them. And if it is successful, I say don't fix what isn't broken, right? But a majority rules vote is exactly what it says. So the majority that is voting on whatever the decision is rules. And that can be challenging if there is not a lot of representation of community-based folks, for example, right? If there is a lot of representation from criminal justice and systems-based folks, but there is very little representation from community-based folks, it can be challenging to feel like there is equitable decision-making. Or if it's the opposite, right? I've seen SARTs that have a lot of community-based folks that come. Almost every one of the staff from the community-based program come, and then one DA, one law enforcement, and one DAVP. And so systems-based is outnumbered by community-based folks. And that can be really challenging. So if there is any sort of opposing value system that's at the table that has the ability to shut the other one down, it immediately makes it inequitable. But again, I have seen this work in communities that have really good relationships, that have the ability to talk things out, and want to make sure that they are providing equity. But this is the decision-making process they go with. But finally, I want to talk about consensus decision-making, because this is where I have seen the most equity come. And consensus decision-making can be a very long, very tedious process, because it requires 100% consensus from everybody in the room. And so what that means is that one person can prevent something from going forward. But what happens ultimately in consensus decision making, or the hope that it's going to happen, is that there's compromise on all sides, that everybody is coming together to make sure that there is something that all folks can live with, similar to the shared values. There, people are going to have different ideas, but that there is some overlapping that everybody feels like they can work and live within. It can really help bring equity. And I know it sort of feels like nobody wins in that scenario, but I really feel if SARTs are able to keep victim-centered, survivor-led sort of ideas at the forefront, if that is the shared value that folks are working with, then consensus could come back to that piece. How is this survivor-centered, right? Like, is this the most survivor-centered thing? And even if folks have to compromise to get there, that becomes the most important sort of guiding light of the SART. So just to help folks understand consensus decision making a little bit better, I want to just go over the major pieces of it. And the first one is that everybody agrees that it is 100%. It is not a majority rule situation. So everybody has to be on board. And like I said, that can be really challenging and really difficult, and it's going to take compromise on all sides, but it's the process that's going to bring folks there. And so the process is incredibly important. And what happens in the process is there is something proposed, right? There is a decision that is proposed to be made. And in consensus decision making, it is best practice that whatever is proposed is very specific. And then there is a discussion where every single person either participates or actively abstains. So say I abstain from this discussion. There is a test taken, and either consensus is reached or not. And if consensus is not reached, you go back up to the drawing board. So you either try to rewrite the proposal or you have the discussion again until consensus is reached. And again, that can take a really long time. That can take multiple meetings for something that is small. And I know that can feel really tedious. I think sometimes the worry with consensus decision making, because there's the ability for one person to hold up the process instead of a majority rules, is they can have there is ways to set up sort of back channels, right? Of like, if we have this discussion for 3 SART meetings in a row, we go to a majority rule votes. But those rules, regulations, and sort of workarounds need to be written into protocol and need to be written to how the decision-making process works. And everybody at the table really should be on board to make sure that there is buy-in and inequity. So now I want to talk about the importance of evaluation. What evaluation is going to do is it's going to give folks an understanding about whether or not the goals that they have set for their SART and set to make sure that there is a coordinated response to sexual violence in the community, whether or not those are being met. So why do we evaluate? Why is it important to have evaluation? It's important to have evaluation because we need to hear from people that are experiencing the system. What I have seen SARTs do a lot, and I think this is a very normal thing to do, but what SARTs often do is they listen to the people that they are serving, right? Not necessarily the people that have experienced the system, but the people that they're actively serving. And in not all times, but most of the time, people that they are serving are having a good experience in that service. And so they're staying engaged. What they're missing is people that did not have a good experience in the system or with whatever service it is and disengaged. They aren't getting those voices because the evaluation isn't covering all people that are experiencing the system, whether they stay engaged or not. And then not just the system, any resource. Another reason is what I said before, whether or not you're meeting your goals. You don't know whether or not survivors feel safe, supported, coming forward to report to law enforcement. If it is a goal that that survivors feel safe coming forward to report to law enforcement, you don't know whether or not that goal is being met unless you're hearing from people that are reporting to law enforcement and what they're experiencing. So by having evaluation in place, you have the ability to know whether or not goals are being met. You also can identify gaps and find solutions. So with evaluation, you can listen to folks and understand where there may be gaps. And so if you talk to maybe the homeless community, that has experienced sexual violence, you can see whether or not you're meeting the needs of that community in response to the sexual violence that they've experienced, right? And if you're not, you have the ability to talk to those folks to find out what solutions you can put in place as a SART. And then finally, find areas of collaboration. So by identifying gaps, you're also going to be able to find places that you can come together with other folks and resources in the community to make a stronger, more collaborative response to sexual violence. So there's a few different type of evaluation measures. Each of them have pros and cons. The first is review of documents and data. So this is something that you can do with documents that may already be in place or data that you may already be collecting. And so if an agency is already collecting, for example, demographic data on their intake, there's the ability to sort of collect and evaluate demographic data. So for example, if the community-based resource agency is collecting demographic data on folks that are accessing resources who've experienced sexual violence, you could look at that data in comparison to folks that are reporting to law enforcement who have experienced sexual violence and see if there are any communities that may be accessing confidential resources but are not willing to come forward to criminal justice. And you're not going to fix, you are not going to ever create a system where all folks want to come forward, because criminal justice is not going to work for some folks, no matter how supportive criminal justice is, because that's not what they want to do. And it's up to survivors to decide. However, there are gaps in survivors not coming forward because they do feel like it's unsafe or it's inequitable. And so finding that and hearing from folks and looking at the data and seeing who is accessing resources versus who is reporting can be a good place to start understanding why some folks might not be coming forward. The pros to that are that you have that data already, right? You have the ability to look at that and access that data already. So you don't have to create a lot of structure to be able to do it. You may have to implement some collection and evaluation measures, which could take some resources that folks don't have, but that stuff is already there for you all to be able to look at. The next is questionnaires and surveys. Questionnaires and surveys is going to be getting basic information from people, right? You're going to utilize questionnaires and surveys when you are trying to get information that doesn't require a lot of nuance. You might be able to add some space to write some answers, but you are going to miss a lot of nuance in questionnaires and surveys. But there is a lot of data that you can collect and understand for those, and they're really useful. Some of the pros is that you are able to formulate and ask very specific questions and find very specific information. But it does take a lot of resources to create those. And not all communities and SARTs have that. In fact, I would say a lot of them don't. But it can be a place to start for folks to work on for something to have moving forward, right? It might not be available right away, but it could be something that SARTs choose to work on to have evaluation measures down the road. Next is interviews and focus groups. So interviews and focus groups are going to get you that more nuanced information. It's going to help you understand why of survivors instead of just the what. It's going to give you an opportunity to listen to different folks in the community and take some of that information and be able to see areas of collaboration, fill some gaps, and help support better. It's also going to give you, I think, the ability to understand what are some of the needs that aren't being met that you can't get from a questionnaire and survey, that you need to sort of talk to somebody to understand. These take a lot of resources. And so it can be hard for SARTs and small communities to do this. But again, as a long-term goal, it can give real important information to communities about what survivors need that you can't necessarily capture in data or a quick questionnaire and survey. And then finally, there's case file review. I think case file review is a really important thing to do for SARTs in general. This is another thing that most SARTs already have access to. I've seen a lot of SARTs utilize cases that are already closed, and then they go back through those cases and sort of see what are areas that they could better collaborate, or what are places that they need to fill gaps. Where did the person where were sort of some of the areas that they could do better, right? Like, it is a review to see how the system, in the ways that the system worked, in the ways that the system did not work, and how can better support folks that are within the system. Now, case file review typically only works for reporting survivors because it is an understanding of the entire system. And so it is not capturing survivors that aren't reporting. And I think that can be a real missed opportunity that some of the other evaluation methods could possibly get to. So the takeaways from our presentation today are that it's important to have successful SARTs in the community. Balancing the needs of the survivor and accountability for those that cause harm is incredibly important. Understanding who's causing harm in the community, and then making sure that there is accountability, and so survivors feel safe, the community feels safer, is really important. That is the purpose of SARTs, really, is to create stronger communities, to create stronger survivor-centered services and trauma-informed services, to create healthier counties overall. Next piece of a successful SART is to value collaboration, coordination, and education. So those things are going to be the cornerstone of what makes your SART successful. Working with other folks, finding those places for overlap. If you're struggling to figure out how to connect, some of those cross trainings, like maybe community-based advocacy, writing along with law enforcement to really understand what they're doing, or SANES coming in to talk about the importance of a safe exam, right? Some of those cross trainings, those places for collaboration and coordination in education, are incredibly important to help folks understand how to best work together. Acknowledging the power imbalance and then working towards equity. I think this is an incredibly important value to make sure that SARCs are working successfully, and that you are capturing all folks in the community that need your support and resources. And then finally, utilizing evaluation to ensure that you're meeting the needs of survivors. So making sure that all the goals that the SART puts in place are actually being met. Making sure that you are listening to survivors, inviting survivors to be part of the SART if they want to take part in helping at that level, if they want to participate in helping create better sexual assault response in the county. But making sure that you are utilizing evaluation to ensure that needs of the survivors in your county are being met. And that's everything. Thank you so much for your time today. That is my email at the bottom, and I look forward to seeing folks at our question and answer session. Thanks so much.